My name is Don Arnold. I'm a urologist. I have a fellowship in endourology and robotics, and I work for SIH. Today is an exciting day. We're going to be doing what's called a percutaneous nephrolithotomy. That's a procedure that is performed in patients when they have extremely large kidney stones, and we have to use a team approach in their management, which we'll get into later today. We're going to emphasize each area that is important for the success of this case. That will include anesthesia, that will include materials, that will include sterile processing. That will also include how the OR manages the resources needed for this case. So I will show you how each one of these teams is essential for the success of this procedure. This procedure is not uncommon, as it's performed by urologists all over the country almost every day of the year. What's intriguing about our procedure is we do ours slightly differently. At most locations, either the urologist will gain his or her access on the day of surgery, or interventional radiology will gain access on the day of surgery for the procedure. The way we do it here is there's a collaborative conversation between myself and the interventional radiologist in determining where the appropriate access should be. And that is done 1 week prior to the surgery. The reason why we wait a week is to allow any healing, bleeding, and infectious process to present itself prior to doing our surgical procedure. What we have noticed is we have higher stone clearance rates, we have less bleeding issues, and we have less infectious issues that prevent us from doing the procedure.
My name is Pam Sparling, and I am a certified registered nurse anesthetist. I've been with SIH for 18 years, and I've been here at Heron Hospital for the last 3. My job is to talk to the patient preoperatively. Myself and our anesthesiologist form a care plan for the patient's anesthesia, and we administer the anesthesia, keep the patient comfortable, asleep, and when the procedure's over, we wake them up and take them to recovery room.
My name is Tanya Street. I'm the materials coordinator for the peri-op services. Our contribution is to make sure that we have all of the supplies and the equipment to make sure that everything's going to go smoothly for any case. We will do kind of a double check a couple days out, make sure that we're good to go, maybe order a few extra supplies if needed, and then we coordinate with SPD and the rest of the team to make sure that everything's going to go smooth the day of.
My name is Marcia. I work in sterile processing. I've been here for 14 years. We oversee getting things ready for surgeries, making sure that we have everything that is needed for the case, such as with Dr. Arnold today. We make sure that all the instruments are clean, they're sterilized. We pull the cases, so we have to make sure that everything that he needs for that case is inside that case cart. It's something that we do on a daily. We meet with the heads of the service. We go over the preference sheet with them, and we make sure that he has everything that he needs for that case for that day.
I'm Dee Benz. I'm the Assistant Director of Surgical Services for Heron Hospital. So I oversee the teams in the operating room, same-day surgery, post-anesthesia care unit, and pre-anesthesia testing here at Heron Hospital. For every specialty service in the operating room, we have 2 team members that are service line leaders for that specialty. So urology is the same. We have an operating room technician, service line leader, as well as an operating room RN service line leader. And they are really the key players in ensuring that we are prepared for all procedures.
My name is Rachel Neipert, and I work for Heron Hospital. I'm a certified OR technician. I basically assist Dr. Arnold. I will be handing him the things that he needs, or holding and helping in any way that I possibly can to make sure that everything goes flawlessly and that we get that patient out of the room and into recovery and ready to go.
Today I am assisting Dr. Arnold with his laser operation. I am making sure that his laser is on after intubation of our patient. I then make sure that we are on the procedure that we are doing, and then I verify with the doctor that his settings are to his needs, and I let him know that he is ready to laser.
I am Kendra Lambert. I am a registered nurse here at Heron Hospital. I am the head of service for urology. I coordinate with sterile processing to make sure that we have all the instrumentation that we're going to need for the case. I coordinate with materials, so we know we're going to have all the materials necessary. And then I try to come in the night before and set up the room, because these are extensive cases and there's so much going on that I like to have everything prepared for the day of the case. I like these cases because there is so much going on. I like the excitement of it. I like the way that he does it because it is very controlled. If you watch other PCNLs that they do, it's a very bloody procedure, whereas this, it's very controlled and calm, and the most we have is a lot of fluid everywhere, but fluid is better than blood. I think it's better for the patient, less blood loss. They seem to recover better. They're a little bit more prepared on what to expect for the procedure.
My name is Michael Ramsey. I'm an X-ray tech here at Heron Hospital, and I do a lot of the surgery cases with a lot of the doctors here. A C-arm tech is an X-ray tech that works one of the C-arms up in the surgery units. What we do a lot of times is we will help the doctors on the internal portions of the body so they don't have to do as open a procedure as they used to do. So for this case in particular, we'll be taking pictures of the kidneys while he's putting his leads in and his wires, and then we'll slide down to the bladder when he runs the wire down to the bladder, and then back and forth to the kidney, whichever position he needs to be looking at the specific time.
The C-arms that we use are formulated in order to give us an excellent picture with the severe reduced amount in the radiation. So you will see our radiation use throughout the procedure is minimal.
My name is Daniel Sheffer. I'm a PACU nurse at Heron Hospital. PACU is recovery, so it's basically post-anesthesia care unit is the name. We basically get them ready to either go to the floor or discharge home. So there's criteria that have to be met. 30-minute minimum stay. We're waking the patient up, making sure they're safe.